Alrighty, well, we will go ahead and get started and folks can continue to filter in. Thank you all so much for being here today. We're really excited to continue this four-part webinar series. Uh, my name is Elizabeth Branham, and I'm a traffic safety specialist at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And thank you for being here for our second installment of our four-part webinar series, Preliminary Data Collection Methods and Results from Ohio. Thank you to our partners, Prevention Action Alliance and the Ohio Traffic Safety Office for partnering with us on our impaired road use prevention efforts throughout Ohio. Today, myself, Dr. Jim Lang, and Paige Carter will be presenting. And before we dive into the webinar, feel free to introduce yourself in the chat. We would love to see where everyone is joining us from today. The mission of the Higher Education Center is to help colleges and universities develop, implement, and evaluate programs and policies to reduce problems experienced by students due to alcohol and other drug misuse. The center was reestablished at The Ohio State University in 2014, thanks to the Conrad Hilton Foundation. Higher Ed Center is an interdisciplinary center with strong partnerships between the College of Pharmacy, the College of Social Work, and the Office of Student Life. We provide a number of services to colleges and universities, including tools, trainings like this one today, and technical assistance. Our learning objectives for the webinar today are as follows. At the end of this webinar, we hope you will be able to explain the issue of collegiate impaired road use, including trends related to drowsy driving and cannabis impaired driving, explain trends related to impaired riding on alternative vehicles, such as bikes, scooters, and skateboards. And lastly, we would also like you to understand how to deploy existing measurement tools to assess impaired driving at your university. These are tools that we created with the input of experts in the field, and we will discuss how you could implement them to gather some traffic safety data at your institution later on in the presentation. Dr. Stacy Hoff was our first presenter in last month's webinar, and she did a really excellent job laying the foundation and outlining data on impaired driving among the young adult population. But if you were not able to attend that webinar, and as a refresher, I'm going to outline some available national data on impaired road use among this population. And then later on, we will dive more specifically into some data that we collected in Ohio. Unfortunately, every 39 minutes, someone dies in an alcohol impaired driving crash, which equates to around 13,500 people every year. In 2022, 30% of drivers who were fatally injured in a crash had a blood alcohol content of 0.08 or higher. National College Health Assessment reference data from spring 2024 revealed that of students who had both driven and drank in the past 30 days, 12.8% of them drove after drinking any alcohol. And of students who had both used cannabis and driven in the past 30 days, 29.7% of them drove after using cannabis. And from the Monitoring the Future panel study, we know that those attending four-year colleges between the ages of 19 and 22, 16.7% of them reported driving under the influence of any alcohol, or driving after consuming 5 or more drinks, after using marijuana, or after using illicit substances in the past 2 weeks when surveyed. This chart here depicts the percentage of traffic fatalities in each state that involved alcohol. We are specifically focusing on Ohio throughout this webinar series, but if you are joining us from another state, we invite you to take a look at this chart and see how your state compares nationally. Alcohol impaired road use is a significant concern in Ohio, as reflected by these numbers. I'm going to turn it over to Jim now to talk about the underpinnings of impaired driving.
So when we start talking about the issue of impaired driving, it's helpful to sort of broaden our thinking because there's a lot to the behavior. It's not just a particular choice, it's also based on all sorts of things. So when you're, so as we're talking about measurement, we're also going to be talking about some of these aspects, but we can even step back farther and just think about driving and road use. When we do that, we realize that it's it's a very regulated environment. In fact, probably one of the most regulated environments that you interact with in any given day. And, you know, where else other than on the roads are you told which way to actually go? But it helps a lot that everyone is on the same page. And so that's regulated quite a bit. Substance use is also highly regulated. So purchasing alcohol, it has to be from some sort of licensed or governmentally approved store. All the production of alcohol, other drugs may be even more regulated. So those regulations are really important to think about when we start talking about the behaviors, the driving part and the consumption. But then from within the individual, understanding risks is important. People need to understand the laws, but they also need to understand the risks. And then also the various behaviors and choices that they have. So drivers make decisions. And so all of that needs to be kind of in our head as we're talking about developing solutions to the risky road use. And then we're starting to say road use, and that's because we're recognizing that it's not just drivers anymore, right? So expanding what we're talking about is important, especially with the college population. You can go to the next slide. That said, we don't have a lot of data or a lot of information on all the ways campuses are addressing impaired driving. In general, there isn't a lot of ways campuses are addressing that particular issue. But we do have a little bit of data from the college alcohol study, which is a longitudinal study that's been going on since the 70s. And within that, there are some items where campuses were asked, professionals from the campus was asked about the programs that their campus uses. And so we can look at some trends at a couple of those types of interventions. So safe ride programs and designated driver were the only ones really asked about for impaired driving prevention. And you'll see, so that's the red line with a little diamond and the green line with the squares. And you'll see that the red line and those green lines are on the lower part of the efforts that campuses are using and possibly even going down. While some of the other types of programs like services for recovery students, substance abuse problem, individual motivational interviews, all great things. Don't want to say that those shouldn't be on the upward swing, but impaired driving programs tend to be a little bit shortchanged and maybe even going down. Go to the next slide. So programs, as I was saying, we need to kind of broaden some of the thinking, but one way to help us conceptualize how we're broadening is to think about the social ecological model, sometimes shortened to SEM model. So what is important is that we often focus on the individual and their choices and their behaviors, and we have to do that. But a lot of these choices are happening within friend groups, perhaps. If they're going to parties, college students don't tend to go alone. There's interpersonal relationships and influences. So that's an important component of what ends up happening at the end of the evening. The institution and the policies around the institution and also the norms of the institution are important concepts as well that we have to think about. But then, especially for road use, that is a community aspect. There are roads on many campuses, but there's a whole lot more in the community. And in general, that's where the impaired road use ends up being, is within the community. So the community aspect of this is really important. to consider as we're talking about this issue. And then as I mentioned, driving is highly regulated. That's public policy. Are policies being enforced? How much does the society support ways to avoid and impaired driving? So all of those come into play. And I think you can go to the next slide, and I think I hand it off to Liz again.
There's many ways that you could measure impaired road use at your university, but there are two different ways that we tested during a pilot project in Washington, D.C., and that is through an environmental scan and a short survey, and those are the two tools that we will be discussing with you today. So the purpose of the environmental scan is to develop a comprehensive understanding of how the environment in and around your campus impacts the risky road use behaviors that occur among your students. Through the process of completing the scan, you will really start to develop a comprehensive understanding of the issue and how the environment impacts the issue. The scan takes you through a series of questions and asks you to compile data that you have related to substance use and impaired road use. In addition to identifying the data that you do have, you'll find that there are several data points that you don't have, and you can kind of tuck that away for later and fill in those gaps if you're able to complete the traffic safety survey after that. And while you might have data on substance use, you might not have alcohol and drug policy violation data or information about medical transports. And so you might need to reach out to other departments to get those questions that are on the scan answered, like the parking and transportation office, campus safety and security. Because impaired driving is a complex behavior, there are a lot of partners that should be brought to the table. And we found that if you start to engage the partners early on in the work through the environmental scan process, it really helps to develop those relationships before you start your prevention work. Additionally, bringing partners in at this stage during the scan process, it will help to develop a shared responsibility for this issue on your campus, so that helping to solve this problem does not solely rely on you. And it also helps partners to recognize this as a problem of concern. So through the process of completing the scan, you will really gather a picture of what impaired road use and student traffic safety behaviors are on your campus. So the scan is broken into 6 different sections: the campus characteristics, student data, social environment, physical environment, enforcement, and additional factors sections. And there are a series of questions within each section. Campus demographics establishes how many students are at your institution and what proportions they fall into across freshmen, sophomore, junior, seniors, and graduate students. Whether or not students have access to cars and can park on campus, and what the cost associated with that is. This is important to establish, as campuses sometimes assume that impaired driving is not an issue on their campus due to policies limiting underclassmen parking privileges. So looking into that and seeing how many students there are will help you to understand what that could look like. This section also asks about rideshare scooter access. The student data section, I think, is really useful even if you don't end up doing impaired driving prevention work. This is just a really good process to go through for your general substance use prevention as well. This section asks about whether or not data is collected on different substance use behaviors and what those data points are. This is a good exercise, again, to determine what data gaps exist on your campus. And if you decide to deploy the survey later on, these questions will help you to understand how you can fill those gaps. Questions include alcohol and cannabis use consumption, impaired driving behavior, awareness of the harms and consequences of impaired driving, and information about policy violations and medical transport. Policy violations are mandated to be reported within the Clery Act report. So if you have trouble finding that data, you could start there. You also might find throughout this process that you don't have this data, and that's okay. You can leave those sections blank and fill in the gaps later on, as I've discussed. The social environment section dives into different educational and prevention programming that exists on your campus. such as alternative activities, what the process looks like for students once they receive a conduct violation, what recovery supports exist, what the fraternity and sorority life environment is on your campus, and what high use substance times of the year are common on your campus. So maybe St. Patrick's Day is a really big deal, or New Year's. Additionally, this section asks about student attitudes around drinking and driving. And this data could be gathered by doing focus groups with students. So hopefully you can kind of start to see how doing this environmental scan could serve your other goals for your programming as well. In the physical environment section, you'll really start to look at the actual environment and how the physical environment can play a role in this problem. So you'll explore student access to public transportation, bars and restaurants, and cannabis dispensaries, how close to bars and restaurants offering different happy hour promotions is your campus? Do your students have access to buses or any other sort of public transportation offerings? Are there dedicated bike lanes? Are there any areas of concern that stand out to you when you walk around your campus? Are there different intersections or areas that you notice would be hard for students to navigate in the evenings, on the weekends? And then one of the reasons that we can overlook this issue coming to the enforcement section is that we don't always hear about it. And that can be due to a reporting gap between law enforcement administering a citation for a DUI and your campus administration. So would your campus be notified if a student were found to be driving impaired off campus? So the section establishes whether or not there's an agreement between campus police and local police to provide mutual assistance and notifications about citations, if DUI patrols or checkpoints occur on or near your campus, and if your campus police are trained driver recognition experts. And then lastly, the additional factors section allows you to make any additional observations that haven't been captured in the other sections and to report on how weather impacts traffic safety on your campus. So those are the different components of the scan, and obviously this is customizable to you. If you want to add or take out anything in the scan, you're more than welcome to do so. And we hope that it could really help you to understand many factors that can play a role on impaired driving risk on your campus. I'm going to turn it over to Jim now to talk about the survey to be developed.
Thanks, Liz. So what we found was that a lot of campuses don't have a handle on what the driving behavior is amongst their students, and especially in the realm of impaired driving. Several years ago, the Higher Ed Center started a monthly call of experts around impaired driving and, whenever possible, collegiate impaired driving as part of our effort to move the field so that we got better about prevention of impaired driving amongst college students. And one of the things that stood out was, while there are some surveys that have some impaired driving questions, there aren't very many surveys or questionnaires that campuses could easily use to get a handle on what the behaviors are on their campus, and also deploy it often enough to track changes and see if interventions are working and improving the situation. So you can go to the next slide. And so we needed to kind of develop something. And with that working group, we came up with some parameters. It needed to be short enough that people could actually use it on their campus in various ways, including intercept sampling, which I think is a really important concept on a college campus, because it's difficult to do whole student body surveying. There's a lot of surveying already going on college campuses usually, and it's cumbersome. to get the data in that manner. So something that is quick, easy to deploy in various settings, specific enough to give you data that is useful for this effort, and also expanding our concept of impaired driving to impaired road use means looking at other ways people are using the roadways. So that's bikes, scooters, skateboards, and having those within it is kind of an important component. Our working group helped point out. And so we can go to the next slide. We can start looking at a little bit. Now, this graphic is small. It looks a lot better on the cell phones. And there's a little mock cell phone or smartphone, what it would look like. So students can quickly answer questions, but one of the things that we had to do was set a cut point for our concern. So when you talk about, well, did you drive after drinking? We need to give them some parameters, like when are you talking about after? How many hours are you talking about? How much drinking? And so within that concept, we came up with, made choices for the survey. So for alcohol, for instance, we talk about 2 hours. Within 2 hours of 3 or more drinks. That is obviously a conservative definition of impaired, but it is something that we would want to know if they've gone above that, because then there's a chance that someone was actually driving impaired. So we had to make those sort of choices, and that's where the expert panel was very helpful in reviewing those choices. Cannabis was even more difficult because there's less of an established set of where impairment is on cannabis use. In this one, we talk about driving after 5 hours, within 5 hours of smoking or vaping, and somewhat unique to our the survey set is we separate inhaled forms of cannabis and eaten forms. And so with that, because we know there's a difference in the impairment and the duration of the impairment, we talk about 9 hours of drinking or eating cannabis products. And then we also looked at combined alcohol and cannabis, a question about impaired other drugs. And then very similar to impaired driving is distracted driving. And it is a risk. We're talking about a risk population as well when we're talking about young adults. And so we ask about use of a phone while driving, and also speeding, and also lack of sleep. So it gives a more rich set of items of concern that can either be thrown at the students all at once, or maybe footholds can be gotten. For instance, the lack of sleep issue, there might be a sleep hygiene program on a campus within the health promotion department, but have they talked about impaired driving because of the lack of sleep? And so that's the sort of thing that could happen if people are looking at it a little bit more broadly. You can go to the next slide. And I'm there. I'm going to pass it on to Paige.
Thank you, Jim. I'm going to talk a little more in depth about the measure in practice. So we'll examine it through kind of the scope of the latest data collection that we conducted in the fall. The measure consists of 28 items, and we received over 2,000 responses, and our final sample size was 701. So responses are removed either to falling outside of our target age range, which was kind of actually the most common reason that we excluded response, or perhaps like quality. We distributed the measure as a panel survey. So we contracted a company, Qualtrics. They have a pool of pre-recruited respondents who receive and then complete surveys that they qualify for based on demographic criteria. In our case, that was living in Ohio and being aged 18 to 24. Qualtrics manages the recruitment, and then they compensate like participants through like a points-based system. On average, it took respondents about 8 minutes to complete the survey, and this collection took place between September and October of 2024. And you can move to the next slide. I briefly want to touch on what the survey is capable of measuring in the interest of emphasizing the data that it could provide to you and your campus. So you can incorporate it into a survey like Dr. Lang mentioned, and you can gain perspective on the issues of impaired driving, riding behaviors, the use of alternative transportation options. And it measures those frequencies of those behaviors, and then of those same behaviors, it measures risk perceptions and social norms. So it offers this comprehensive understanding of not just the frequency of engagement in these behaviors, but also kind of the campus social culture perspective surrounding these transportation and traffic safety issues. You can move to the next slide. To provide a little context for our findings, these next couple slides will summarize briefly the demographics of our participants. So our quotas were set to be representative of the population in Ohio. And for the most part, we were successful in this. The Hispanic Latino population is a little higher in our sample than it is true to the Ohio population. And the gender distribution, as you can see on the right there, is a little more frequently male respondents than female. And non-binary and other gender minorities were not represented in the sample. You can move to the next slide. This is a breakdown of the age of the respondents and then also enrollment, which was obviously of interest in our sample. And you can see that we had 63% of respondents who reported being enrolled in classes in the past 30 days, and then 36% who were not enrolled. You can move to the next slide. So we have a little bit of an understanding of what the survey intends to measure and some of the demographics of our sample, so we can dive into the results from that collection in Ohio. There's a lot of valuable insight that you can gain, but we're going to highlight these 4 areas of interest to share with you today. And we'll look at the association between risk perceptions, so danger and legal, and engagement in those behaviors, exploring the influence of enrollment in some of these impaired driving behaviors. In our sample, that really emphasizes that college students are at a high risk for these behaviors. And then we'll also look at some rates of alternative modes of transportation and their associated rates of impaired operation through the lens of enrollment. And to conclude, I have a graph that compares the collection from this past fall to our piloted version of the survey, and it highlights kind of the impact of academic year on survey distribution. So we can move to the next slide. This is just a distribution of driving rates in the sample broken down into enrollment. Often campuses that we've talked to, tried to engage in this work are under the assumption that impaired driving isn't a topic of primary concern because their students aren't driving. And in our sample, we see that overwhelmingly that they are, and actually more frequently than their non-enrolled counterparts. You can move to the next slide. This graph outlines the rates of self-reported impaired driving behaviors in the sample. Respondents that are included in those percentages that you see, they reported engaging in whatever behavior that bar represents at least once in the past 30 days. The most common form of impairment was drowsy driving, so driving after having less than 5 hours of sleep. And you can see it's a pretty high number. It's a pretty 62% is pretty wide representation in the sample. And that's followed by cannabis consumption inhalation, 35%, cannabis consumption ingestion at 33%, alcohol, driving within 2 hours of three or more alcoholic drinks, and then simultaneous alcohol and cannabis use at 25%. Not included on this graph, so we do ask, as Dr. Lang mentioned, about speeding and seatbelt use. And what I have at the top of my head is speeding. 79% of participants engage in that behavior, and so that is a frequently engaged in behavior as well. And you can move to the next slide. On this graph, we're looking at that same bar, We've superimposed the perceived danger, the danger perceptions of the sample. And the trend that appears is one that highlights danger perceptions increasing, right, as these rates of engagement and whatever behavior decrease. I think very notably on this graph, you can see that the highest reported behavior sleep actually exceeds its measure of danger perception and frequency. And on the next slide, move to the next slide, we see that same trend, right? With respondents' perceptions of the likelihood of experiencing legal consequences from engaging in those various behaviors. And notably, again, right, very much so exceeding that perceived likelihood of legal consequence for driving after having less than 5 hours of sleep. And we can move to the next slide. The graph on the left here, it depicts the association between enrollment status and engagement in driving after alcohol use. And then on the graph on the right, there breaks it down by age group. We're going to look at the same set of graphs for each of these impairment types. And the thing that I want to highlight that's consistent across these impairment types is that college students are at a higher risk for all of these behaviors. So we can move to the next slide. This is cannabis inhalation. Compared to the alcohol frequencies, right, we have a little bit smaller of a gap between the enrolled and non-enrolled young adults, but still college students at a higher risk. We can move to the next slide. This is cannabis ingestion, driving within 9 hours of eating or drinking a cannabis product. And again, right, we see our college students at a higher risk. We can move to the next slide. This is simultaneous alcohol and cannabis use. We can move to the next slide. And then this is driving after having less than 5 hours of sleep. And we see our college students at a higher risk, but looking at this graph, something that stands out to me is it's just very highly reported in both of these groups. And we can move. And the table on this slide contains statistical analysis on that series of graphs on the left that we had just looked at, the association between enrollment status and engagement in impaired driving. We performed chi-square tests. I think the important thing to be taking from here is that for each of those behaviors, that relationship between enrollment and impaired driving, the p-value is less than 0.01, which in this sample then, right, we're looking at this correlation being statistically significant. So the impact of enrollment and engagement in those behaviors, there's a relationship that's being revealed. We can move to the next slide. And then as we mentioned earlier in the presentation, the measure also examines rates of non-traditional transportation use. And we look particularly at bicycling, scootering, and skateboarding, longboarding. And bicycling was the most commonly reported, 44%, followed by scootering at 27%, and then skateboarding, longboarding, 15%. And it also asks about like the use of e-bikes. So I know that those have been kind of on the rise of e-bikes and e-scootering and those powered different powered micro-mobility types as well. For our sample, we've broken these transportation types into enrollment status, right? But for a sample on campus, this could be class rank or commuter status. Looking at these behaviors, we can see that enrolled students are engaging in biking and scootering and skateboarding a little more frequently than their non-enrolled counterparts. And the sample size at the bottom there is just emphasizing that this isn't from the whole sample. So these are from people who indicated, right, that they biked. We can move to the next slide. And so the measure also looks at alcohol impairment with these alternative transportation types. And on this graph, we're looking at that again by enrollment status. We can see that our enrolled young adults are engaging in impaired operation of these different transportation types more frequently than their non-enrolled counterparts. We can look at the next slide. And then this is cannabis use as well. I think we see something notable, and this is the skateboarding and longboarding group. There's a little less impact there. So when we're thinking about different demographic variables and what is most salient. And this is our final graph, and it highlights the impact between various external factors that you can have, on data collection. And for this one, the time of year, we're looking at October versus May. So when you're deploying, survey, like gathering data on your campus, keeping that in mind, right, that the time of year might impact the results of your survey. And so, while you might not have the bandwidth to survey like thousands of students or even 700 students at your institution on their traffic safety behaviors, any data is going to be helpful in developing prevention or intervention strategies to start addressing these behaviors on campus. You can deploy the survey at pre-existing events that you're going to be tabling out already, right? You have a QR code, maybe some candy bars. I have heard that there's lots of success with that method, the candy bar method. They're, snowball sampling, so passing it to maybe some peer health educators and having them hand out to their friends. If you teach a class, you could encourage your students to take the survey for extra credit. And additionally, you could take some surveys, take some questions from that survey and just stick it onto a survey that you're already deploying at your campus. Just a couple of them maybe that you have interest. If you've done the NCHA survey before and you've seen, certain trends already in impaired driving, maybe focusing on, cannabis or alcohol. And I believe I'm passing it back over to Liz.
So these two tools that we have talked about today, the environmental scan and the survey, are free for you to access. So if you're interested in receiving them to be able to gather data on impaired driving on your campus, you can access them through this link that Paige is going to drop in the chat, and I'll also follow up with via email. As I said, for the environmental scan, you can tailor this to your specific campus needs. For the environmental scan, we have also developed some email templates, as I talked about, reaching out to different departments for alcohol policy violation numbers and parking things, and just those different components of the scan. So you can use those email templates and send those out to different offices to request those specific pieces of information that you might not already have. And then for the survey, we will send you those survey questions, and you can input them to whatever surveying tool you have access to. And then Jim's going to talk a little bit about how this applies to the strategic prevention framework.
Thanks, Liz. Talking about the measure is important because it helps you frame your interventions. It also helps you track whether or not what you're doing is effective. I do want to say, in terms of the survey items, they are available, and I hope you check them out and consider using them. You'll notice that it doesn't have demographic elements or other types of questions, with the concept that you could be including this in another survey, or you need to put in what you find useful for your population. And that assessment is very important. And this strategic framework, probably you've seen this in one way or another, but it's a really helpful thing to have in your mind, that you kind of can go around this flower and be more strategic in that regard. So assessment is the first thing that you kind of have to do. You got to know what it is you're trying to prevent. You got to know what the prevalence are, who's doing it, all that. Without that, you really are just guessing on what to do. And it also, assessment is very helpful in developing capacity, because there's sometimes some resistance to doing work around impaired driving. It often is because people don't understand that this is a serious issue for our college students. And so because it's not tending to happen on campus. It might be near campus, but it also could be far from campus. And so understanding that it is an issue for your students really can come from assessment, and that will help with capacity building. It also helps with planning to know, more about their risk perception. What are the vehicles that they're using on the roads? Who are the ones who are most at risk? That all helps with your planning. And then, of course, you do something. That's the point. And then evaluation happens again. And that evaluation kind of goes into the assessment component. You want to see what happened with your intervention, and then assess where do you need to go again in this cycle. So all of this is tied together, but measurement is often one of the pieces that is missing from campuses who are kind of wondering if they should be doing something or what they should do on their campus around impaired road use. And so we're trying our best to give you some tools so you can start this process in a really strategic way, and that is with measurement and assessment. And with that, I think I hand it back to Liz, right?
In addition to developing the environmental scan and survey tool, the Higher Ed Center has a grant from the Ohio Traffic Safety Office to convene Ohio campuses around the issue of impaired road use, and we would love for you to join us. So if you're here today and you're activated on the issue of impaired road use on your campus, and around your campus, as Jim discussed, but you're not really sure where to start or kind of how to be involved in that, this is a great place to start. We will guide you through the steps of assessment and planning and intervention, and you'll have the support of colleagues from around the state. Campuses involved in this initiative will collaborate with and learn from one another while addressing impaired road use among their student populations. You'll have a chance to measure impaired road use through the tools that we discussed today, and we will provide you training and technical assistance on how to implement them. And then you will develop prevention strategies to make improvements to this issue among your student population. We have formed similar groups in DC and are working on a national cohort as well. And campuses have reported really enjoying time to connect with one another on this issue and be able to learn from one another. Following your attendance at the webinar today, I will follow up with you via email with a link to join the initiative if you're interested. And that will take you to a qualitative form you can fill out, and then I'll circle back with you about your interest. We also have information sessions. If you want to learn a little bit more about that, Monday, March 17th from 10 to 10:30 and Wednesday, March 19th from 1 to 1:30 p.m. Please come. We would love to have you there. That is all the content we have for you today. We would love to take your questions. Feel free to drop them in the chat. And I also want to make you aware of the next webinar in this series, where we'll be talking about partnerships that you can involve and engage with to do this work, including some that we talked about today briefly that you would connect with throughout the environmental scan process, like campus security, and also talking about some unique partnerships that you might not have developed before, such as with bars and cannabis dispensaries. I will stop sharing, and if you have any questions for us, either about the environmental scan or any of the content we talked about today, I can field those now. And Cindy put the registration for the March webinar in the chat as well. Yeah, environmental scans are a process, from my understanding, that really came from the business world, but has been adapted to work for public health issues as well. And it can be adapted to be done within a community instead of on a campus setting. You might want to kind of broaden those questions out to be things that more apply to you, but you can absolutely adapt it to your community. I don't know if you have anything to add to that, Jim.
Yeah, I mean, it's really taking a look at your community. And so the community that we're focusing on is the college, but we are also asking questions about where do the students drink, which may not be on the campus, so that you better understand. And that absolutely could be adapted easily to other settings like the community. You just may not talk about residents and non-residents and things like that, but skip the parts that are just really specific to colleges, and you can still find value in exploring this issue in a kind of guided way.
Nancy, yes, you will be able to get a copy of the survey. Let me see where that link was in the chat. Cindy posted in the chat the environmental scan / survey tool request for access link that's further up in there. So, oh yeah, thank you, Paige. And we will send you the survey items. Okay, well, thank you everybody for being here today. We really appreciate your time and to learn more about this issue, and we hope that you're able to gather some data and learn more about it within your community. We hope to see you at the next webinar in the series. Thanks, everybody.